Good day. My name is Okon Ruth Mayane Abasi. I'm from Nigeria, specifically from Akwa Ibom State. I was born and bred in Lagos, Nigeria, and I'm here to share my journey with you as a final year student of Ekwa College of Nursing Sciences, Igwe Kogi State. I want to tell you that each stripe on my Nightingale cap has been earned with so much dignity, and it has also been earned through tears, through sweat, and through dedication and God's grace also. I chose nursing as not just as a profession or a career. I chose it as a calling because I believe that it's an expression, or it's an avenue for me to be able to express my deepest desire, which is a great responsibility for human and for mankind and for safety of so many. So in my going to 3 years now in this profession, I've learned so much, and I believe that this career opens doors for me to be able to stand in the gap for people in their most vulnerable states, and also be able to speak and advocate for people's dignity. My core values are integrity. As an upcoming professional nurse, I believe so much in integrity, and I believe in trust. I believe that this is one of the core values where patients earn their trust with nurses, and this is what I strive after: honesty. Another of my core value is excellence. I'm happy to say that I started this career, my journey as a nurse, on a high note, as the as the best students, as the very best students on after we call it ICS. 6 months after 6 months exam, I was the best, and I was given so many awards and credits. But I believe this is one of my core values because it has kept me going. Starting on that high pedestal, it reminds me every day that I cannot go backward, I cannot fail, and I need to do better. Even apart from academics, even my profession. In the hospital, whenever we go for our postings, I strive towards excellence. I strive towards making my patients seen, and I strive towards accountability, making my patients, giving them reassurance that they can count on me. I can be counted on. Um, I've seen, though this profession is a very productive one, and it's one that I would choose over and over again. However, there are so many things that I'm bothered about, and I believe that I can prefer solutions to it. One problem I find and I care about in this nursing profession is shortage of staff and nurses' mental health. Over the years, I've learned that nurses, especially staff nurses I've worked with, they experience a huge amount of burnout. Why? Because of the shortage in the staff in this hospital, and because of how hard they work, and the client to nurses ratio, it's quite high and it's not balanced well. And one way I believe can be a solution is when we can focus better on the mental health of nurses. We shouldn't just believe that since we are health professionals, we can just ignore our mental health. It is very, very important, because what we don't have, we cannot give, and we need to be stable mentally to be able to help our patients to become better and take them out of their vulnerability. Another problem, however, or an issue that I care about is limited professional recognition. I believe that nursing isn't just about administration of medications. I hope to also be a voice in this profession, in the sense that I believe that nurses can do better. I believe that we can be a push, we can be a voice, we can be a force even in our environment, in our community, in our society at large. So one way I would love us to do better, or a solution that can help to solve this problem, is if we can contribute to leadership, if we can work better, especially with our doctors, pharmacists, laboratories, if you can have an interprofessional collaboration, helping us to be better recognized, and also carrying out awareness, making people to know the issues that they are facing right now, and how they can prefer, and how we can help them to come out of those issues and give them solutions to them. My nursing context, in conclusion, I've faced several challenges even as a student. I know it's so easy and so early for me to say that, but I've learned so many things that I've not been taught in the four walls of my classroom. And one thing is that I believe that no matter the challenges I face, all these challenges help me. It's all shaping me into this resilient person, into this resilient, compassionate professional who is patient centered and who is able to go out all out while considering my own mental and physical health, or my health at large, and also making a difference in my society. I find myself here in, I wouldn't say it's a local environment, but it is not as densely populated as Lagos State, Nigeria. But here in Egbekogi State, I've been faced with so many issues, so many crises, so many health awareness, some things, some conditions I didn't even know existed. I find people here facing it at a very large amount, and I've been at a very large high rate scale. And I believe that my experience here would even help me no matter where I find myself after my graduation here now in November. I believe that I would be able to stand out. I'll be able to be different because I've tasted sweet part and I've tasted the bitter part, and I know that there is a difference. So I really appreciate your time here. I appreciate your attention. I'm glad to walk you through my journey, and I hope it was an eventful one. Thank you for listening to me. Bye bye.